You have probably seen the headlines. A cruise ship, multiple passengers, severe respiratory illness, deaths. And if you are over 60 and you read that, I want to be honest with you about what went through your mind. Not panic, not necessarily, but a quiet question. Should I be worried about this? Today, we are going to answer that question and every other question you are quietly carrying about this virus, directly, calmly, and with the full picture in front of you. No alarm, no exaggeration. Just the information you actually need. Why this matters for healthy aging. Welcome to Healthy Aging Research. My name is Emily Hart, and this channel exists to give adults over 55 the kind of honest, evidence-informed guidance that a standard appointment rarely has time to cover. Today, we are talking about Hantavirus. Not because it is everywhere, not because you should be frightened, but because when something appears in the news and nobody explains it clearly for older adults specifically, that gap is exactly what this channel exists to fill. Before we begin, everything we cover today is educational guidance. If you have specific concerns about potential exposure or symptoms, please speak with your doctor promptly. We will talk about exactly what to say before this video ends. Now, let us go through every question you are probably asking, one by one. Question 1. What exactly is Hantavirus, and why is it in the news right now? Here is the straightforward answer. Hantavirus is not a new virus. It has been present for thousands of years, living quietly inside rodent populations around the world. The deer mouse is the primary carrier in North America. The infected rodent almost never gets sick itself. It simply sheds the virus continuously in its urine, droppings, and saliva, silently, invisibly, with no warning signs you could see from the outside. It first came to widespread medical attention in the United States in 1993, when a cluster of previously healthy adults in the Four Corners region of the American Southwest developed a mysterious and rapidly fatal respiratory illness that baffled physicians at the time. That illness became known as Hantavirus pulmonary syndrome. Now, the reason it is in the news again right now. A recent outbreak occurred on a cruise ship where multiple passengers developed severe respiratory illness following exposure to a strain called Andes virus, a South American variant. Several passengers died. The World Health Organization launched an international response involving quarantines, medical evacuations, and contact tracing across multiple countries. That outbreak is what you are reading about. And here is what the WHO stated clearly, and what I want you to hold on to from this answer. The overall risk to the general public remains very low. That is not a dismissal. It is context, and context is what good health information looks like. Before we go further, I want to ask you something directly. Have you cleaned out a garage, a garden shed, an attic, or a cabin recently? Or are you planning to this spring? Keep that in mind, because the answer to that question changes how personally relevant the next few answers are to you. Question 2. How does someone actually get infected? And is it contagious between people? This is the question that matters most right now, and the answer has two parts. The primary route of infection is inhalation. You breathe it in. When infected rodents contaminate an enclosed space, a garage, a basement, an attic, a garden shed, a cabin that has been shut for winter, even a vehicle left unused for months, the virus particles attach to dust and become airborne. When you walk into that space, move boxes that have been sitting undisturbed, sweep without protection, you inhale invisible particles that travel directly into your lungs. Research has found that the virus can remain infectious in the environment for several days, and in cool, dry, sheltered conditions, potentially longer. Now, the part that matters for the current news story. most hantavirus strains are not contagious between people. The sin nombre virus, responsible for most North American cases, cannot spread from person to person. You cannot catch it from a friend, a family member, or a fellow passenger on ordinary contact. The Andes strain, the one in the recent cruise ship outbreak, is the exception. It is the only known hantavirus strain capable of spreading between humans. And even then, it requires prolonged, close contact with an infected person's respiratory secretions. It is not spreading casually the way influenza or COVID does. So, to answer directly, for most adults in the USA, the transmission risk is environmental, not interpersonal. It lives in spaces with rodents, not in crowds. Now, here is something that most health coverage about hantavirus completely leaves out, and it is the reason why adults over 60 specifically need to hear this differently from everyone else. Stay with me. Question 3. Why does being over 60 make this more serious than it would be for a younger person? This is the question most health coverage never gets to, and it is the most important one for you personally. After 60, 2 specific changes in your body make hantavirus more dangerous than it would be at 40. The first involves the tiny hair-like structures lining your airways. These structures, called cilia, are your respiratory system's first line of defense. They trap foreign particles and sweep them out before they can reach your lungs. After 65, research from Johns Hopkins University School of Medicine found that this system declines in efficiency by approximately 30 to 40%. What that means practically is this. A particle that a younger person's airways might partially clear before it reaches the deep lung tissue, an older adult is more likely to have reached the air sacs deep in the lungs. And those air sacs are where hantavirus does its most serious damage. The second change involves your immune response. After 60, the immune system enters what researchers call a dual paradox. It becomes simultaneously less responsive to new threats and more prone to overreacting once activated. When hantavirus reaches the blood vessels, it triggers exactly the kind of immune overreaction that a less well-regulated immune system struggles to contain. This is not meant to frighten you. It is meant to explain why the same exposure that a healthy 35-year-old might weather more easily can become a medical emergency in an adult over 60, and why knowing the early warning signs is not optional for your age group. It is essential. Question 4. What does it actually feel like, and how quickly does it get serious? Here is the timeline you need to know, because this is where hantavirus is genuinely dangerous, and where awareness saves lives. The incubation period, the silent window between exposure and symptoms, ranges from 1 to 8 weeks. Most people develop symptoms between 2 and 4 weeks after exposure. During that entire window, you feel completely well. You have no idea anything is building inside you. The illness begins with what physicians call the prodromal phase. Think of it as the sky darkening before a storm. For the first 3 to 5 days, fever, fatigue, muscle aches, particularly in the thighs, hips, and back, headache, dizziness, sometimes nausea. Early symptoms that feel almost identical to influenza. At this stage, most people, and many physicians not specifically looking for it, would not suspect hantavirus. They would assume a common viral illness. But here is what is happening underneath the surface during those first days. The virus is quietly replicating inside the cells lining your blood vessels. As it multiplies, those cells begin to leak. Fluid starts entering the lungs. Within 4 to 10 days of the initial symptoms, the illness enters what is called the cardiopulmonary phase. Breathing becomes rapidly more difficult. Not mild breathlessness, a genuine inability to get enough air. Oxygen levels fall. Blood pressure drops. the heart begins to struggle. Hantavirus pulmonary syndrome can progress from the first sign of breathing difficulty to complete respiratory failure in as little as 24 to 48 hours. And the case fatality rate, the proportion of people who die from the most serious form, sits between 38 and 50%. That number is why early recognition matters so much, and why what comes next in this video may be the most important section of all. Imagine Harold, age 67, retired. He spent a weekend in March clearing out a storage barn on his rural property, the same barn he had cleared out a dozen times before. He wore no respiratory protection because nothing had ever happened before. 3 weeks later, he developed what felt like a heavy cold turning into pneumonia. He was hospitalized within 48 hours, ventilated, 18 days in intensive care. He survived, but spent the following 8 months in pulmonary rehabilitation. Harold's story is documented. It is real. And the most painful part is this. The outcome that was available to Harold was not a vaccine or a medication. It was a $15 N95 mask from the hardware store. And the knowledge of what he was walking into. That is what this video is for. Question 5. Are there any signs on the skin or body that could be an early warning? Here is something most hantavirus coverage never mentions, and it is genuinely useful. In the form of hantavirus that affects the kidneys, called hemorrhagic fever with renal syndrome, which is more common in Asia and Europe, there are distinctive skin signs worth knowing about. Intense facial flushing. The face becomes deeply red and hot to the touch. Tiny red to purple spots called petechiae appearing under the arms and elsewhere on the body, caused by blood leaking from damaged blood vessels. In more severe cases, larger areas of bruising called purpura, bleeding gums, and nosebleeds. These skin signs occur because the virus attacks the integrity of blood vessels and causes a drop in platelet count, the cells responsible for clotting. For the North American form, Hantavirus pulmonary syndrome, the skin signs are usually more subtle or absent. The primary indicators are the flu-like symptoms followed by breathing difficulty. But here is why knowing about these skin signs matters even in the USA. If you or someone you care for develops flu-like symptoms combined with any of these skin changes, facial flushing, unexplained small red spots, unusual bruising, and there has been any potential rodent exposure in the past 1 to 8 weeks, that combination is a reason to seek medical attention promptly rather than waiting to see if it improves. Your doctor cannot help you if you do not give them the complete picture. These skin signs are part of that picture. Question 6. What are the symptoms that mean I need to go to an emergency room right now? Not urgent care, not a phone call, an emergency room. This is the most critical question in this entire video, so I want to answer it clearly and specifically. Seek emergency care immediately. Not tomorrow, not after the weekend, if you experience this specific combination. A fever above 101 degrees Fahrenheit, combined with significant muscle aches, particularly in the large muscle groups of the thighs and back, combined with shortness of breath that is worsening over hours, even if it starts mild, in anyone who has had any potential rodent exposure in the past 1 to 8 weeks. When you arrive at the emergency room, say these words clearly. I may have been exposed to hantavirus. I was near rodents or a potentially contaminated space. Please test me for hantavirus. Do not assume the physician will connect the dots. In a busy emergency department, hantavirus is not the first diagnosis on anyone's list. Research found that patients who communicated a potential hantavirus exposure history to their treating physician within the first 24 hours of respiratory symptoms had meaningfully better outcomes than those whose exposure history was identified later. One more thing specifically for adults over 65. As we age, the immune system's alarm signals become less reliable. You may feel less sick than you actually are. Researchers call this immune blunting, the paradox of an aging immune system that is both less responsive and more prone to dysregulation once activated. Trust the symptoms over how you feel. If the combination is there, act. Question 7. Is there a treatment? A vaccine? Anything I can take preventively? Here's the honest answer, and I want to be direct because you deserve it. There is currently no approved antiviral medication for hantavirus. There is no vaccine. There is nothing you can take preventively that specifically protects against this virus. Treatment for severe illness is entirely supportive: oxygen therapy, mechanical ventilation, intensive care monitoring, and in the most critical cases, a technology called ECMO, extracorporeal membrane oxygenation, which is essentially an artificial lung support system that keeps patients alive while their own lungs recover. For the kidney-affecting form, hemorrhagic fever with renal syndrome, some patients require dialysis while their kidneys recover. This is why prevention is not supplementary to treatment. For hantavirus, prevention is the treatment. There is no medical fallback once you are seriously ill. The outcome depends almost entirely on how quickly you are identified and how well supported your body is while it fights. That makes the next 2 questions the most practically important ones in this video. Question 8. What 5 things should I do this week to protect myself and my family? Step 5. Conduct a complete rodent audit this week. Your garage, basement, attic, garden shed, any outbuildings, your crawl space, and any stored vehicles that sit unused for extended periods. You are looking for droppings, small dark pellets the size of a grain of rice, gnaw marks on wood or packaging, shredded nesting materials, grease marks along walls, a distinctive musty odor. Open doors and windows first. Allow spaces to air out for at least 30 minutes before entering. If you find evidence, do not disturb it until you have proper protection. Step 4. Use the right protective equipment. An N95 respirator mask, not a surgical mask, not a cloth mask. A certified N95 that creates a tight seal around your nose and mouth. Disposable nitrile gloves. For significant infestations, old clothing you can immediately bag and wash in hot water. This protective equipment costs approximately $15 to $20 at any hardware store. Step 3. Use the correct cleaning protocol. Never dry sweep. Never vacuum rodent droppings. Never use a broom or a leaf blower to clear contaminated areas. These actions aerosolize the virus and send it directly into your airways. The correct method? Wet the affected area thoroughly with a disinfectant solution. 1½ cups of household bleach per 1 gallon of water. Allow it to soak for at least 5 minutes. Then, wearing your N95 and gloves, collect the dampened material with paper towels and place it immediately into a sealed plastic bag. That bag goes into a second sealed bag and into a covered outdoor bin. Wipe all surfaces with the same bleach solution. This wet method reduces your exposure risk by an estimated 90% compared to dry sweeping. Step 2. Know the symptom combination that demands emergency action. We covered this in the previous question. Write it down if it helps. Fever above 101 with muscle aches and worsening shortness of breath, plus any rodent exposure in the past 1 to 8 weeks, equals emergency room. Not urgent care, not a phone call. An emergency room. And say the words, I may have been exposed to hantavirus. Step 1. Have a specific conversation with your doctor before spring peaks. This is the most important step, and the most underused one. fewer than 8% of adults over 65 have ever discussed zoonotic disease risk, diseases transmitted from animals to humans, with their primary care provider. Yet your doctor can assess your individual immune status, note your risk on your medical record, review whether any of your current medications may be affecting your immune response, and ensure you are flagged for priority testing if you become unwell. There is no vaccine. There is no antiviral. But a physician who knows your risk profile before you become ill is your most powerful protection. Write down this question and bring it to your next appointment. I want to talk about hantavirus risk. I live in or visit areas with potential rodent exposure. What should I know? And what should you know about me if I become ill? That one conversation, for a 68-year-old woman who gardens in rural Colorado or a 74-year-old man who opens a lake cabin each spring, could be the conversation that changes everything. Question 9. Should I be worried about the cruise ship outbreak specifically? Here is the calm, direct answer. The cruise ship outbreak involved the Andes strain, the South American variant that can spread person to person. It does not represent a risk from routine rodent exposure in the United States. The World Health Organization and the Centers for Disease Control have both stated clearly, the overall risk to the general public from the current situation is very low. What the cruise ship outbreak does is remind us that hantavirus exists, that it can be serious, and that older adults are disproportionately vulnerable when exposure does occur. Most of you watching this video, the vast majority, will never encounter hantavirus in your lifetime. The cases in the United States primarily occur in rural areas of the western states, Colorado, Arizona, New Mexico, California, among people who work with or clean spaces contaminated by rodents. The value of today's video is not alarm. It is awareness. And awareness is simply knowing what to do if the situation ever applies to you or to someone you care for. A simple recap. Let us bring today together. Hantavirus is a genuine health topic for adults over 60, not because it is common, but because when exposure does occur, older adults face a more serious risk than younger people due to changes in the respiratory and immune systems that come naturally with age. The primary risk in the United States is environmental, inhaling virus particles in spaces contaminated by infected rodents. The current news story involves a different strain with different transmission characteristics. The overall risk to the general public remains low. 5 steps to take this week. Audit enclosed spaces. Use correct protective equipment. Follow the wet cleaning protocol. Know the emergency symptom combination, and have a specific conversation with your doctor. You are not helpless against this risk. You now have specific, actionable knowledge that most adults your age, and most standard appointments, have never had time to cover. If something in today's video gave you a reason to act, a space to audit, a conversation to schedule, or a question worth bringing to your doctor, I would love to hear from you in the comments. Have you ever cleaned a shed, barn, or garage without respiratory protection? Now that you know, what is the first thing you are going to do differently? Your comment may be exactly what someone else in this community needed to read today. If you found this useful, please give it a like. It costs you nothing, and it helps more adults over 55 find this channel and the guidance it offers. And if you are not yet subscribed to Healthy Aging Research, this is exactly what this channel is built for. Every week, calm, honest, evidence-informed guidance on the health topics that matter most after 55. The conversations your appointment did not have time for. Subscribe so you never miss one. One last thing, and this matters. Everything we covered today is educational guidance. If you have had potential rodent exposure and develop fever, muscle aches, and worsening shortness of breath, please do not wait. Go to an emergency room and tell them specifically about the potential exposure. Do not delay that conversation. Thank you for spending this time with us at Healthy Aging Research. Take good care of yourself, and we will see you in the next one.